Welcome back. Get this, women are not only living longer, but their quality of life has improved in the last 30 years. Great information there. That's thanks in part to improved treatments, better medications, and better screening. This morning, Dr. Jennifer.bigelow, an OBGYN from West Jefferson Medical Center, is here to talk about some of the most common health problems older women face and what they can do. Good morning, Dr. Jennifer.
Good morning, Malik. How are you?
I am good. I am really enjoying this conversation we're having this morning about women's health because it's important that we talk about this not only during the month of October for Breast Cancer Awareness Month, but all months throughout the year. We were talking a little bit earlier about how breast cancer can be, found through mammograms. For those who may have missed that earlier segment, can you tell us when should a woman get her first mammogram? And since we're talking about older women, can they ever stop getting mammograms?
Yeah, that's a great question. And thank you also for having me on the show today. I appreciate that. Women should start getting their mammograms when they turn 40. Some doctors may begin when their patients turn 50. We in our practice prefer to start a little earlier, and a woman should have one at least every 1 to 2 years. And unless they have a history of cancer, they could probably stop around age 75, but they should speak to their practitioner about that.
Very important that you speak with your doctor. Now, another thing that a lot of women get pap smears, but there's also a separate test called an HPV test that is being done now because that actually helps cause cervical cancer, HPV?
That's correct. HPV, we now know, is the cause of cervical cancer. And so your doctor may collect an HPV test in addition to a pap smear, or they may collect an HPV test if the pap smear comes back abnormal. But that can definitely tell us your risk of developing cervical cancer in the next few years.
Is there a certain age that we need to get the HPV test done? Do we get that when we get a pap smear?
Often it's done, it varies. So if you have a particular abnormal pap, oftentimes an HPV test will automatically follow. Some doctors are doing co-testing at the same time as a pap smear. So when you start getting pap smears, likely a co-test will be done if those practitioners follow those guidelines.
And it's also important to note that a pap smear and a pelvic exam are two different things. Both need to be done, but they are a little different, correct?
Exactly. So a pap smear is when the doctor collects a sample from the cervix and from the vagina in order to determine if the cells are normal or if they're abnormal. And there's other things that can be detected on a pap smear too, besides cancer, including infections and other things. But a pelvic exam is when the doctor actually examines the internal organs, such as the uterus and or the ovaries. So two different things.
And I know for a lot of women and men out there, when we get older, we get excited that maybe we don't have to go to the doctor as often. But what are some things that women can stop getting at the age of 65? Or are there things, or we still need to be getting all of these procedures done, women specifically after the age of 65?
Right. So certain women may be able to stop having a pap smear at 65. However, if you had a hysterectomy for cancer, for cervical cancer or for precancer, then it would be important to continue getting your pap smears. Or if in the last 20 years, you've had a severe precancerous lesion or pap smear result, or if you are immunosuppressed, if you take medications that can affect your immune system, or if when you were younger, you were exposed to something called diethylstilbestrol when you were in the womb, actually. So any of those things, you would still need to continue getting pap smears, and your practitioner is going to want to perform a pelvic exam again. So it's best to continue going to your routine annual exams and discussing with your practitioner what you really need to have done.
And another condition I know women face, as well as honestly anyone, is osteoporosis. For women out there, how can they prevent osteoporosis? What's the age range that women start to get osteoporosis?
Right. So osteoporosis really starts when a woman begins to have the changes associated with perimenopause and menopause. And what osteoporosis is a failure of the bone to be remade, or too much is broken down. And that's related to your estrogen hormones and other things, but also how much calcium and how much vitamin D you intake in your diet, and also in supplements. Many women aren't getting enough calcium and vitamin D in their diet alone, or vitamin D is really from exposure to sunlight, and a lot of us aren't getting enough sunlight exposure. Also, weight-bearing exercise is really important to build our bone strength, even as a young woman, and continuing into older age, and avoiding smoking, because smoking can cause osteoporosis as well.
Awesome, great tips this morning. Doctor, thank you so much for coming on the show this morning to talk about women's health, specifically for my senior women out there. We love the senior women, all the women out there. Thank you so much, Doctor. And hey,
Yes.
so you can find more information about women's health. Just log on to wjmc.org/survive.